The question was asked to me the other day. Could you explain a little bit how co-payments, co-insurance, deductibles work your out-of-pocket max for my health insurance? Oftentimes people are confused on how these things all apply, how they work, and how they're processed under your insurance plan. And I'm happy to answer this question. If you have a health insurance policy that requires that you pay a co-payment, this is a co-payment that you would pay possibly to your primary care physician for a sick doctor visit. Maybe it's a $25, $40, $50 copay, but you'd only pay that co-payment if you were going to your primary care physician for a sick doctor visit. Of course, preventative coverage is covered at 100%. Your annual well doctor visit, as long as it's coded by the physician as an annual well doctor visit, that would be covered by your insurance at 100%. Preventative labs for your annual well doctor visit. Once again, as long as they're coded by the doctor as preventative, not diagnostic. It's very important because sometimes we go to our doctor's office and we're going to have a well doctor visit, our annual physical, and we start talking to the doctor about some other things that are going on. Unfortunately, when that happens, there are times when your doctor may change the code from a well doctor visit, which would be covered at 100%, to a non-routine or a sick doctor visit. For instance, let's say you're going to your doctor's office and you do your height, your weight, they take your vitals, they do your blood pressure, they get you on that scale, they check your heart, they check your lungs, they do the normal things that you would have done during your annual well doctor visit. And after the doctor's visit, or at the end of the doctor's visit, the doctor says to you, hey Vince, anything else going on that you're concerned about? Have you had any issues through the year? Are you feeling okay? And all of a sudden you kind of remember, you know what, my leg's been bothering me and I don't know why it's been bothering me, or my shoulder's been bothering me and there's some issues going on. Next thing you know, the doctor decides, well, you know what, let's take a look at that, find out what's going on. And what we're going to do is we're going to order some x-rays, find out if you've got an issue with your shoulder or with your leg or something of that nature. Well, unfortunately, that conversation, although you want to have those conversations with your primary care physician, they go from a well doctor visit to being coded as a sick doctor visit. So back to that copayment. Oftentimes when you have a sick doctor visit, you have that copayment to pay. Or some insurance plans will require that you satisfy a deductible for a non-routine visit. Okay, whether it's a $250 deductible or $500 deductible, sometimes it's a $1,000, $1,500, $2,000 deductible, depending on the type of plan that you decide that you want to have for a calendar year. So let's kind of look at that copayment again. You're going to the doctor's office, and instead of a well doctor visit that's covered at 100%, lo and behold, you get out to the doctor's office and they say it's a $25 copayment because it was coded as a sick doctor visit. Well, that copayment goes towards what's called your out-of-pocket max, okay? You've got three buckets. You've got your copayments, you've got your deductibles, and then you have your coinsurance. And how it works is that copayment goes in the copayment bucket, but also goes into your out-of-pocket max bucket for the year, okay? Your deductible, if you have a deductible to satisfy. Back to the scenario where your doctor ordered some x-rays, for instance. So your x-rays require that you have to satisfy your $500 deductible, just as an example. So you go to the radiologist, you have your x-rays, it's $100 for x-rays. You have to pay that $100 because that goes towards your deductible. That is your obligation to pay before your insurance starts paying their portion, which is their co-insurance portion, after you've satisfied your deductible. So you've got your office visit, which was that $25 copay, that's in the bucket. Then you have your $100 that went towards your deductible, that goes in the bucket as well. So now you've got $125 that goes towards your out-of-pocket max for the year. And let's just say your out-of-pocket max is $1,000. So now you've satisfied $125 towards your annual out-of-pocket max. You've satisfied $100 towards your annual $500 deductible. Those copayments, they have nothing to do with deductible. They have nothing to do with your coinsurance. Copayments are completely separate. So you can go to the doctor Your primary care physician will have a copayment, possibly depending on the plan you choose. You can go to a dermatologist or a podiatrist, a pulmonologist, cardiologist. All these types of doctors may require that you pay a copayment if your policy doesn't dictate that you have a deductible to pay for those specific types of visits. So it's very important, especially during your annual enrollment period, to look at the options that you have available to you with your insurance plan to decide, okay, do I want a plan that I have co-payments that I have to pay all the time, or simply, do I want a plan where instead of co-payments, I only have to satisfy a deductible? Because once you've satisfied your deductible for a calendar year, then there's a cost share between your insurance company and yourself. Sometimes that cost share could be 90% the insurance company will pay for something, or 80% the insurance company will pay for something, or 70%. Your cost share would be the opposite, or the factor that leads to 100% coverage. So for instance, if you have a 90-10 co-insurance split, your insurance company is going to pay 90%. You're going to pay 10% until you've satisfied your out-of-pocket max. It is the percentage of your cost share that you're responsible for after you've satisfied your deductible that goes towards your out-of-pocket max. Okay, so you've got your co-payments. If you choose a plan that requires that you have a co-payment to go see a specialist or your primary care physician for a sick doctor visit, that goes towards your out-of-pocket max. You have a deductible that you pay that is your obligation, depending on the plan that you choose and how high that deductible is, that also goes towards your out-of-pocket max. And then you have coinsurance, which is your cost share between the insurance company, their percentage, which is usually higher, most times it's higher, and your portion of your coinsurance cost share, which is lower. Like I said, it could be a 70-30, 70% for the insurance company, 30% for yourself, or it could be an 80-20. It all depends on the type of plan that you decide to choose. Now, all these things, the coinsurance, the deductible and copayment, that all goes towards that bucket, towards your out-of-pocket max. So once you've satisfied your out-of-pocket max for a calendar year, you no longer have to pay anything out of pocket as long as you stay in network. And that's the important part. You need to make sure that once again, you're connecting, either you're calling your member services if your company offers a member services, or you're calling your insurance company, or you're checking your insurance company's website to see what providers are in network with your benefits plan before you seek care. It's very important, especially if you're trying to contain costs for your insurance, to make sure that even though you have a plan that might allow in-network and out-of-network coverage, you're going to have better coverage if you stay in network for a calendar year, okay? Everything's going to accumulate toward your out-of-pocket max as long as you continue to stay in network with your benefits plan. It's really important for you, because once you satisfy that out-of-pocket max, you may have at some point in time an elective surgery. Maybe you want to have something done. Maybe you've got varicose veins in your leg, or you had a shoulder issue, and or maybe, sometimes people, their hips and knees replacement surgery. You would not have to pay anything out of pocket once you satisfy your out-of-pocket max for a calendar year. And once again, as long as you stay in network, okay? So make sure you're checking that your providers, your facilities, your hospitals, your urgent cares, that they are all in network with your benefits plan, okay? So that all that goes towards your out-of-pocket max and accumulates properly. It's really important when you're going to make a doctor's appointment. You have what's called an NPI number. It's the provider identification number that they use for insurance companies to determine whether they are an in-network provider with your insurance plan. So a couple things that you can do before you go seek care. Either, like I said, check with your insurance company or member services, or go on your insurance company's website and get the name of the doctor, the address. Make sure the address that you're going to is the address that shows that they're in network with their benefits plan. Check their NPI number. Make sure that they are currently contracted with your insurance plan as well. Okay, these are things that you all need to do to take responsibility, because you can't have any surprises. And unfortunately, it becomes more and more difficult if you just kind of rely on, for instance, Let's say you go to your primary care physician and your primary care physician says, hey, you know what, Vince, you got a problem with your leg. We're going to get an x-ray. We're going to send you over to an orthopedic doctor. And here's a good orthopedic doctor that you should see. Unfortunately, some people think or believe that their doctor is referring them to another doctor, in this case an orthopedist, that's in network with your insurance plan. Your doctors have no idea what doctors, what facilities, what radiologist facilities are in network with your benefits plan. If we as consumers, health insurance consumers, have a difficult time determining who's in network, trying to track who's in network, looking for a network, doctors and doctors' offices, they don't have the time, nor do they have the resources to know who's in network with your insurance plan, and who's in network with your neighbor's insurance plan, and who's in network with your other friend's insurance plan, or your mother's insurance plan, or father's insurance plan. They have no idea. They're referring you to people or other doctors that they are confident in their skills and that they know, and so they have a referral network that they send you to, okay? So they don't know who's in network. So if you get a name of a doctor, the first thing you do is you want to find out the full name of the doctor, then call the doctor's office and find out how they bill. It's important to understand how they bill. Are they billing through a group? Are they billing through the individual doctor's NPI number? And you can get that NPI number and you can ask them specifically, may I have the NPI number for the office and how you bill for my insurance company? You can cross-check that information on the insurance company's website. That way you know with certainty that this doctor, this facility, this urgent care, wherever you go, the hospital that the doctor may perform surgeries at, that hospital is in network with your benefits plan. It's your responsibility, it's your insurance, it's your health care, and you have to take responsibility to find all this information out. So please don't just kind of go under the assumption that, hey, my doc knows where I'm supposed to go, they're going to send me to an in-network provider. They don't have those resources. They don't have time to do that. That's what we have to do as consumers. We have to be aware, we have to do our due diligence, and we have to do our research to make sure that we understand where we're going, okay? So that's really important, especially when we're talking about the coverage and benefits and what we originally started talking about, co-payments, deductibles, and coinsurance, okay? So those things could change if we're going to an out-of-network doctor. We end up going to an out-of-network doctor, our coverage is not the same as going in-network. It's going to be less for the insurance company and more for you. And it's not going to go towards the same out-of-pocket max because you're going to an out-of-network doctor. Albeit you might have an out-of-network, out-of-pocket max, but that's not going to be the same as if you went to an in-network provider. So very important, make sure you understand, especially when you're choosing your insurance plan for the next calendar year. Open enrollment comes up at the end of the year. You're going to be getting your information at some point in time, September, October, November, that open enrollment is coming up. Take the opportunity, don't assume that just because everything's rolling over, you don't have to make an election, everything will roll over to be the same. You don't want to do that. You want to take the time, as much as it's a pain in the neck to have to do this sometimes, you have to take the time to go through this information. Look at your open enrollment information. Decide what plans are best for you and your family. If you're a high usage insurance person, pay more for your monthly premiums, so you're paying less in co-payments, you're paying less in deductibles, and your out-of-pocket max is less in a calendar year, as opposed to somebody that doesn't use their insurance, where you can pay a lower monthly premium, but when you go seek care, your co-payments are higher, your deductibles are higher, and your obligation as far as out-of-pocket max would be higher. But the likelihood of you using your insurance is less than those people that need to use their insurance more often. So be a smart consumer, understand the co-payments, understand the deductible, understand the co-insurance, and know that all these three buckets go into one bucket, which is your out-of-pocket max. Do your research, make sure you're finding out the NPI number for the doctors, confirm that they're in network with your benefits plan, so all your visits for a calendar year go to that out-of-pocket max. And then at some point in time, hopefully you don't have to use your insurance, but if you did have to use your insurance and you satisfy your out-of-pocket max in September or October or even November, you might be able to schedule that elective surgery at the end of the year after you've satisfied that out-of-pocket max and not have to pay anything out of pocket yourself. So questions, concerns, if you have any other questions, by all means, don't hesitate. Put some comments down in the comments box. I'd be more than happy. This video was created because there was a question asked as far as coinsurance and co-payments and how this all works. So I appreciate the question. Thank you very much. Please forward this to your friends. It's a very important video because with open enrollment coming up, people need to be aware. They need to be good consumers. They need to be intelligent and educated in regards to their health insurance. And I'm hoping that this information is educational and informative for you, your friends, and your family. If it is, please share it. Please subscribe, hit the notification button so you know when the next video is going to pop up on YouTube. It helps YouTube know that my content is important content to be sharing with other people that have insurance questions or concerns. Until the next time, please be careful, stay healthy, and please come back and check out our next video. Have a great night. Bye now.